welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone. Lovely to see you all. Good morning again, and we are here at Health Hour. And I know that we don't take it lightly on a Saturday morning that you're here to learn more about your health and well-being, and we're really honored to have you here. My name is Dr. Vanessa Rapier, and I'm a consultant in sexual health and HIV, and I have the honor today to host our Health Hour. And I'm really excited because as always on Health Hour, we have fantastic doctors that share their experiences with us and just really help us to guide that life in the way that we need to go. And today we have the pleasure of Dr. Joyce Ameh, who is an NHS GP. And we're going to be hearing about how to live healthily with diabetes. So just that whole concept of diabetes and wider lifestyle management. And I think in our communities, we're affected in so many ways, whether it's us personally or whether it's those in our families or social network. And so it's not just that you're thinking, okay, I haven't got diabetes, this isn't relevant to me, because actually I'm sure that the guidance we're going to get applies to us all, to prevent diabetes and also to help manage you. So I'm going to stop there and I'm going to hand over to Dr. Ameh to take us through her seminar. And the key thing is today is that this session, as always, is for you. So it's an opportunity for you to learn, but also to ask questions as well. So we have the chat, so feel free to write your questions as you go along within the chat, and we'll be checking that. So Dr. Ameh will kindly answer those questions at the end. But also, within the Q&A after, there'll be an opportunity for you to put up your hand with the Zoom tool and then also ask your questions verbally. So it's an interactive session for you. So with no further ado, Dr. Ameh, over to you.
Thank you very much, Dr. Appiah, and good morning, everybody. It's my absolute pleasure to be here this morning, to see all your shiny faces this morning. Thank you so much, CAHN, for inviting me. I have been on a couple of times in the past. I actually saw my face on the intro video this morning, but it's my pleasure to be talking in this month of May, talking about diabetes, a condition that has affected me in my family and the community as well. So thank you so much. So this is the topic for this morning. We're going to be talking about type 2 diabetes and lifestyle management. And so really, as Dr. Appiah was saying at the beginning, we're going to be talking about the various ways that we can manage our health without prescriptions, without medication. This is outside medication. Medication has its place, and do not stop taking it. But if you don't have diabetes, and you are of high risk, or you have what we call the metabolic syndrome, there are certain things that you can do now to prevent yourself from getting it. If you do have type 2 diabetes already, there are certain things that you could do to manage and improve your health and possibly even reverse it. We'll talk about that. This is me, is a little bit about who I am. I am an NHS GP. I've got a practice in central Manchester. So a lot of patients in my practice have type 2 diabetes. And I also am an aesthetics doctor. I got a private clinic in the south of Manchester where I perform non-surgical cosmetic treatments. And I'm also, like I said, I've got many hats. I'm also a health coach and a lifestyle physician. And I'm just about writing up a course called the Dr. Ameh's Metabolic Coaching course, in which I teach and educate people how to improve their health without medication. Basically what we're going to be talking about today. I am also a member of my church, an active member of Audacious Church, and a wife and a mother. So I would like to start with some definitions first. And if I'm talking too fast, forgive me, I am a fast talker, and I'm going to try and talk in layman language so that we all understand what we're talking about. But there are certain things that you need to understand. You need to understand what diabetes is, why some people have it, and how, because once we understand the origins of this condition, we can begin to understand how we can treat and manage it. Okay, so we're going to talk about some definitions. You're going to hear me speak about insulin resistance. And insulin is a hormone. We've all heard of insulin. It's a hormone that is secreted by certain cells in the pancreas. I'm not here to talk so much about the origin of diabetes, but you need to have some basics. The problem with people with the metabolic syndrome and with diabetes is that their cells become resistant to insulin. Insulin does two things. First of all, when you eat a certain food that stimulates the production of insulin, mainly your carbohydrates, insulin allows the glucose to enter your cells so you can use up the glucose. Your glucose is like fuel for your car. So when you eat and you've got glucose in your blood, the insulin allows the glucose to enter your cells and be used. And the excess insulin, the excess glucose rather, is converted to fat. The problem is, for certain reasons, your body becomes resistant to insulin. So you eat your glucose, your food, you have a spike of your insulin, and you still have a lot of glucose within your blood. It's not being utilized by your cells, and that is what is called insulin resistance. This slide shows it in better picture, so you can see you're eating the food, your body produces insulin, the cells resist insulin, so you've got lots of glucose floating in your cells. The excess sugar is stored as fat, and you start feeling tired and hungry. So what do? You eat food again. You eat food, you make insulin, the cells resist insulin, the excess sugar is stored as fat, you feel tired and hungry, you eat food, and that is the vicious circle. That is the problem we have with people with insulin resistance. Type 2 diabetes is the most common form of diabetes. There are different types of diabetes, but we used to call it adult onset, although we are seeing young people and even late teens having type 2 diabetes. And it's just a condition where you are unable to use the glucose in your body because the cells are resistant to insulin. If your body has glucose floating around over time, this will cause damage to your body. And that's the problem we have with type 2 diabetes. You will hear words like hyperglycemia. Hyper always means excess or extra or too much of. So when you've got type 2 diabetes, you have too much glucose in your system. And we mentioned insulin resistance already. So who is at risk of developing type 2 diabetes? So who is at risk of developing type 2 diabetes? There's the at-risk group. South Asians also risk. People who are overweight. Sorry, I think something, 1 second.
Oh, great.
Type 2 diabetes, you are at high risk.
Whilst Dr. Ameh is just sorting out the screen, just urging everyone to not to forget to keep putting their questions and thoughts within the chat, because I'm already thinking of questions I want to ask. So I'm sure questions are coming up. So please do put that in the chat while Dr. Ameh just sorts out the video. I think she should be back very soon. So bear with us. Don't go away. Patience is really appreciated. For those of you that have just come on, welcome to CATHIP's Health Hour. I'm really, really happy to have you here. We have Dr. Ameh, who's speaking about diabetes and lifestyle management. We just had a technical glitch, but I can see her beautiful face here. And so I think she is poised and ready to resume.
Apologies for that. I was hearing my voice, I think, when I was recording and trying out the videos earlier on this morning. So I'm back. So sorry about that.
No, not at all. Thank you.
Right. So we're talking about type 2 diabetes. Can you see my slide?
No, I was going to say, Dr. Ameh, would you mind resharing? We lost you when you went off, so that would be great. There's a...
Can you see it now?
We can. Perfect. Thank you so much.
Okay. All right. So once again, apologies for that. So these are the people at risk. I would imagine all of us on the platform are at risk. People of Black, African or Afro-Caribbean descent were at risk of becoming diabetics. Also the South Asians at risk of being diabetic as well. If you've got a family history of diabetes, so somebody in your family was diagnosed or has got diabetes, you are at risk. If you've got high blood pressure or if you are overweight, you are also at risk. So this means you are at risk. It doesn't mean you will get it, okay? It just means that your risk is higher than people who are not in this group. And as I mentioned at the beginning, my goal is for those of us who haven't got it to prevent ourselves from getting it by just our lifestyle changes. So being at risk does not mean you are going to get it at all, but we on this platform are probably all at risk. So I mentioned the metabolic syndrome. We're going to be talking about type 2 diabetes this morning, but there are other conditions, just as an aside, that all the lifestyle changes we will be discussing, these will benefit. So if you've been diagnosed with pre-diabetes, so your GP or your practice nurse has told you that you're not diabetic, but you're on the way to becoming diabetic. If you've got a condition called polycystic ovarian syndrome or PCOS, if you're hypertensive, as mentioned earlier, if you've got non-alcoholic fatty liver disease, if you've had bloods done and you've been told that you've got elevated or raised blood fat, we call those lipids. If you are somebody who's got certain dark patches, now we are dark, so we do get hyperpigmentation, but there are certain almost like velvet-like patches you can get in your armpits and in your groin and in your neck. And most especially if you tend to have fat around your abdomen, we call it truncal obesity, you most likely have a condition called metabolic syndrome. And type 2 diabetes is one of these conditions, and the lifestyle changes we're going to be talking about this morning will benefit all of you, which is really good news. I just want to briefly talk about truncal obesity, because it's something that we see people walking around with. They used to call it beer bellies, you know, some men with large abdomens. And this is fat that is stored in the midsection, fat that is stored in your abdomen. If you are a woman and you store fat on your hips and on your backside, you are far luckier than the woman who, unfortunately, and I'm one of them, who stores fat on their abdomen. This means that the fat is stored close to your internal organs. So it coats your liver, it coats your pancreas, it coats your intestines, your spleen, your kidneys are coated with fat. And the problem is when these organs, because of their use, they have a really good blood supply. And so because they're coated in fat, then the blood has easy access into the bloodstream. And once you have a lot of fat in your bloodstream, you are at risk of developing fatty deposits on your arterial walls, increased blood pressure. You are at risk of developing heart attacks and strokes as well. So having a large abdomen is not a good sign. Well, this morning we are talking about lifestyle changes. So what is our lifestyle? Our lifestyle is basically what we do on a regular basis, what our habits are, how we eat, when we eat, what we eat, how we move, and how we relax. That's basically our lifestyle. And it's interesting to note that research has shown that the way we live can actually influence the conditions we have and the conditions that we can actually cure. And we're going to be talking about each of these changes this morning in some detail. So we're going to be talking about adjusting our diet. We're going to be talking about weight loss, movement, stress reduction. I've put at the bottom quitting smoking. I don't think I need to talk about that, but you just need to be aware that smoking contributes to insulin resistance. And remember at the beginning, I talked about insulin resistance, our cells not recognizing the presence of insulin. So the body's pumping out more and more and more. Smoking isn't helping people with insulin resistance. So a simple thing is cutting that out. But we're going to talk about the diet in quite a bit of detail this morning. The first thing is we need to stop the foods that increase our insulin levels. So if we know that what the problem we have is that our cells are resistant to insulin and our insulin levels are very high, we need to reduce those insulin levels. And the easiest way to do it is to stop the foods that stimulate the production of insulin, our carbohydrates. And I'll talk about which carbohydrates in a minute. One of the ways in which we could do this is to approach a low carbohydrate program, looking at eating foods that are low carbohydrate, the low carbohydrate content. And this is the NHS approach. In my patch of Manchester, we have the honor, the privilege to be able to refer our patients into the NHS Low Carbohydrate Program, where they have shakes and drinks, which are really low carb. And I've seen an absolutely amazing results with patients with diabetes. But you don't need to be under this program. You could just look at what you're eating now and start looking at low carbohydrate options. An easy way of doing that is to look at the glycemic index of foods. Don't worry, I will talk about what that means in a moment. And if we look at our foods and look at the glycemic index of our foods, glycemic index just means the foods that convert into sugar and glucose. And glucose, as we know, stimulates insulin. And those foods with a high glycemic index, they are more likely, they have a bigger response, a bigger insulin response. Those with low glycemic index, you can eat these foods and your insulin is not released. We need to look at increasing the fiber in our food because we all have bacteria within our gut. And these bacteria, the good bacteria, so-called good bacteria, they thrive on fiber. So fiber, eating fiber-rich foods, so important. And then I'm going to talk about intermittent fasting in a minute, because we know if we've got so much insulin, and insulin is released because we're eating food, if you allow your body to rest and have periods where you don't eat, your insulin levels will come down. So we're going to be talking about that in a moment. So as mentioned, what is a low carb diet? This is slightly different to the low carb NHS program, which is brilliant, but this is something that we could all do starting this morning. A low carb diet, carbohydrates are the sugars, the starches, the fibers that are found in fruits, grains, vegetables, and milk. So it's basically our sugars. And we have different types of carbohydrates. We have the simple carbs, like the sweets, sugar, soft drinks, syrups, honey. They are called simple because basically as soon as you eat them, they convert immediately into sugar. Well, if you're eating sugar, there's no need to convert to sugar. You're actually eating sugar. That's a simple carb. And then you've got the complex carbohydrates, and they're the ones who have 3 or more sugars, and they also have fiber as well. And the breakdown into sugar is a lot slower, and that you have a more manageable release of sugar, and therefore your insulin levels will not be so high. And these will be our starchy foods, so our beans, our peas, our lentils, and stuff like that. So these are the complex carbohydrates. So we would be recommending that you go on a low carbohydrate diet. And so you're going to reduce the amount of insulin you are releasing with each meal. And as mentioned, we're talking about the glycemic index. So a glycemic index is just really the amount of sugar each food produces when you eat it. And a low glycemic index diet will be foods that are less than 55. And I've just popped a little chart down here. And I can see, I'm sure you can see, if you look at the left lower point, right at the left lower part, you can see white bread has a glycemic index of 100. It is very high. So basically, when you're eating your white bread, you're eating sugar. The low glycemic index foods will be things like your vegetables. There's no vegetable on that list that is high. Some fruits are high. Interestingly, some fruits, well, I guess it's not interesting because our fruits contain sugar, but watermelon has quite a high glycemic index. That's quite surprising. And also some of our beans have a high glycemic index. So when we're talking about a glycemic index, it will be looking at foods that are low, foods that do not convert into glucose instantly, and therefore do not cause a raised insulin response. I hope I'm making sense. If I'm speaking too fast and I need clarification, we will talk afterwards. And I mentioned intermittent fasting, basically because you release insulin when you eat, and then if you're not eating, you're not releasing insulin. It takes quite a few hours for your insulin levels to come down. And timed restricted feeding, if you are able to do it, I don't recommend it for pregnant women and people who are on insulin themselves, so those type 1 diabetics. But or those people who've got an eating disorder, one has to be careful. But for the vast majority of people, we can incorporate some degree of time-restricted feeding in their lifestyle. And time-restricted feeding just basically confines your feeding window to between 9 to 12 hours. Some people do it less. I personally do eat within an 8-hour window. And there are different types of time-restricted feeding, like you can see on the slide. So I do the 16-8, where I eat within an 8-hour window every day. Some people just skip meals, so they will have their breakfast and then have their evening meal, or you skip your lunch. Some people fast every other day. So on a Monday, they don't eat anything at all. They drink, of course. On the Tuesday, they eat as normal, but on the Wednesday, they don't eat. And that's the alternate day for, fasting. And then there's a very popular 5-2 diet, which was introduced by one of my fellow GPs. And that's the one in which for 2 days a week, you eat either 400 or 500 calories. I'm not a fan of counting calories. I don't have the time for it. But for some people who can and have the time to count calories, that's a good one. But time-restricting feeding is a very good tool in lifestyle management of people with type 2 diabetes. It's a very, very good tool. And especially if you are pre-diabetic or you don't have diabetes at all, it actually protects against metabolic disease. And so the period where you are not actually eating, we call that your fasting window. Your insulin levels reduce, and the benefits of having reduced insulin levels are really, really high. And like I mentioned earlier, we divide our day into two. You divide it into your fasting window, and be aware that you don't eat when you are asleep. So you are basically fasting while sleeping. I mean, I hope most people don't eat while asleep. So if you go to bed at, let's say 10 o'clock at night, and then you don't eat until 10 o'clock in the morning, you've actually already had a 12-hour period where you have not eaten, you have fasted. My goal is obviously for your fasting window to be much longer than 12 hours. If you can get it to 16 hours or even longer, that is more beneficial. But the main problem when we talk about metabolic syndrome is the release of insulin. And therefore, when you are fasting, your insulin levels come down, and the benefits, your body becomes more sensitive, the cells become more sensitive to glucose, improving your glucose sensitivity. You can utilize your sugar levels, and the benefits of that are immense. I've also got a slide showing the benefits of intermittent fasting, reduce insulin resistance. I've mentioned that so many times this morning. You can get reduced weight loss. You have weight loss with it. You can get increased energy. Your sleep pattern is improved if you know your body is resting. You haven't had a whole bag of chips or biscuits just before you sleep. Your insulin levels are already coming down, and it can improve your immunity. It's a really, really powerful tool in the arsenal when we're talking about dietary changes. So to recap with dietary changes, we're looking at a low carb lifestyle, we're looking at a low GI index, and we're looking at intermittent fasting. The second thing that we'll be looking at with lifestyle is moving. Exercise to some people is a dirty word because they just can't do it. But we can, most of us can move. And all we are suggesting this morning is that we move a lot more than we're doing right now. Move more today than you did yesterday. I'm not suggesting you get a gym membership, but if you can afford one and you've got one, then use it. But use moving every single day. Walk instead of using your car. Do squats when you're waiting for your kettle to boil, when you're making a cup of tea. Use the stairs instead of the escalator or the lifts. Walk to your colleague instead of emailing them if they're in the same building. Try and use day-to-day living as much as possible. Exercise is known to actually improve your insulin sensitivity. And I, particularly at work, I do squats when I'm waiting for my kettle to boil. Put the kettle on, and whilst I'm in the kitchen waiting for the kettle to boil, I'm doing squats, or I'll take a tin of beans and start lifting them up and down. So I'm doing some sort of strength training, but move more. If you've got a garden, do some gardening. But you've got legs. If you've got legs, walk a lot more. Exercise is so beneficial to people who have insulin resistance. It's been known to improve the sensitivity of your cells to insulin. So move as much as possible. It's very important. The other thing I would be looking at is your sleep. Now, we all have periods where we have issues with sleep, don't we? Especially a new mother or people who have who work in shifts. In fact, shift workers, I truly feel for you. It is not easy at all. The problem we have with sleep is that if you're not sleeping well, you will find that you have increased levels of cortisol. We will talk about that as well when talking about stress. And increased levels of cortisol actually increases insulin resistance. Okay? We all know how we feel when we've had a good night's sleep, don't we? We wake up and we feel refreshed, we feel ready to go. But when you have poor sleep, you feel very sluggish and your insulin resistance increases. If you've got type 2 diabetes, you really and truly need to address your sleep. Look at ways in which you can improve your sleep in whatever way you can, because that will actually help and improve your insulin resistance and your diabetes. Studies have shown that people who only sleep for short periods of time are at risk of developing obesity, which is a disease, diabetes, and cardiovascular disease. People who've got like obstructive sleep apnea, I don't know whether you know that, or who snore excessively at night, they are at very high risk of developing type 2 diabetes and obesity. So let's look at sleep. It sounds really simple, doesn't it? Get a good night's sleep, but it is very important. And some of the ways in which you can improve your sleep are quite simple. For me, the biggest reason why people struggle with sleep are our devices. We're constantly on our devices, aren't we? These blue lights that are emanating from our devices actually affect our sleep. So put them away for a couple of hours before we go to bed. Start creating a bedtime routine. It's not going to work for all, but try it and see if it helps. Cutting out caffeine after 2 p.m. Did you know that the half-life of caffeine is 6 hours? So if you are drinking a caffeinated drink at 8 o'clock and struggling to sleep at 10 o'clock, it's possibly because of the caffeine that you're drinking. So stop drinking caffeine. I don't drink anything caffeinated after 2 p.m. so that I can try and have a good night's sleep. Alcohol can also disrupt sleep. So those of you who like to go out in the night, that have a weekend binge, be aware that that can affect your sleep as well. And try things like making sure you've got the light blocking curtains, relaxing with music. You could possibly have a bath, create a sort of routine that can help your sleep. And finally, the last thing we're going to talk about is stress. Stress is very similar to sleep in that if you are stressed for a long period of time, your body reduces a hormone called cortisol. Now, cortisol is a hormone that's excreted by a gland in your brain called the adrenal gland, and it increases the cell's resistance to insulin. And so your body will not recognize that you've got lots of insulin in your cells. And it also enhances the production of glucose by the liver. So if you are chronically stressed, if it's work or family life or watching the news or the pandemic, that's a big cause of stress. If you are chronically stressed, be aware that you are at risk of developing type 2 diabetes. And how can we reduce stress? First of all, we need to know that we are stressed. Stress affects every single organ of the body, every organ. It affects your brain, you're going to have headaches, migraines. It affects your heart, you might have palpitations, chest pains. It affects your gut, you might have irritable bowel syndrome. It affects your bladder, you could have irritable bowel syndrome. It affects your joints. Can I go on? It affects every single organ. So the way that I demonstrate stress, usually for me, it's neck pains, might be different from my husband. So you've got to recognize the signs of stress. Once you recognize the signs of stress, try to start to calm down. Things like breathing exercises. You breathe in for 4 counts, hold for 3, breathe out for 5. Breathe in for 4, hold for 3, breathe out for 5. Do that regularly. That can actually help and calm you down. Disconnect from technology, very important, because sometimes all this scrolling through Instagram and Facebook is stressing you out. Plan your week. For me, being unprepared is a big stressor, so I like to plan. Exercise is a really good de-stressor as well. And it's like I mentioned a few times this morning already, it sounds really simple, doesn't it? It sounds that these are simple things. Reduce your stress, improve your diet, improve your sleep. But in combination, the results are absolutely profound. You do not need to suffer from the effects of a condition like type 2 diabetes. You do not need to have it if you don't have it. If you can incorporate some of these tips this morning, you can prevent yourself from getting it. And if you've got it, you can actually reverse it. If picked up early, to be fair, you can actually reverse it. And that is so powerful. This is just another slide showing you in a different way the types in which we can reduce our stress. And thank you. As mentioned earlier, I am setting up a metabolic syndrome coaching course, which is aside from this. We will be talking about mainly this, but in a lot of detail. So please reach out if that is important for you. Thank you.
Thank you so much, Dr. Ameh. I have to say, I always love hosting Health Hour because people always think as doctors, we know all about each other's specialties and we're always reminded of everything, but it's a great opportunity for everyone to learn and for me personally to learn. And I think I have to say to everyone that Dr. Ameh's description of truncal obesity and what that means and thinking of it that we have our fat sitting there, but it's not just affecting the fat that affects us fitting into our dresses, but it also absorbs right down to our organs as well. And because of the blood supply there, it's easy to get that fattiness around our organs. And I thought you explained that beautifully. So thank you so much for spending the time with us this morning. And your job hasn't finished there because as expected, we've got questions coming through, and I'm really, I would also urge people that, again, when we've got experts on, the reason that CATHIP has put together this health hour is that we have doctors that look like ourselves, that understand our lives and give us the explanations that we need that are relevant to our lives. And so I'm just going to go and start through some of the questions. So first of all, one of the earlier questions was about, they'd commented just before you'd actually started talking about the lifestyle changes, but the question was, what sort of lifestyle changes can help those already diabetic to reverse or live better with diabetes? I know that was the essence of the second part, but I wonder just to emphasize, particularly for those thinking, can I reverse changes that have already taken place? Thank you.
So diabetes, hypertension, they are reversible conditions, type 2 diabetes I'm talking about, especially if picked up early. I won't go into too much detail, but there are some type 2 diabetics who are actually on insulin. And that's because the pancreas basically has run out of their own source of insulin. But the main problem with most diabetics is that they have too much insulin in their system. And if picked up early, so the pre-diabetics, those like me who have a family history of diabetes, it can be reversed. The most powerful tool is your diet. That is more important, to be honest, than exercise, sleep, and stress. It's what you're eating. Because if you are eating foods that are not stimulating your pancreas to produce insulin, and if you're giving your body time to recover by intermittent fasting, the response is, it's absolutely fantastic. Honestly, going on a low carbohydrate diet, and for us as Blacks, it is hard, believe me. If I tell you to cut out your rice, bread, yam, potato, dumplings, you'll be thinking, what else are we going to eat? That is the mainstay of our food, isn't it, to be honest? So it's easy as that. And that's why it's so important for us to have our why, to know why we want to make the changes. And so it's our why, our reason, that will propel us, because the changes are not easy. To go on a low carbohydrate diet, living in a Western society is very hard because our food is very carbohydrate heavy. But it is, to answer your question, yes, it is reversible.
Thank you. And I don't know if you've already using this tagline already, but I emphasize it to have your why, because I think that what you've just explained there, I often find when in healthcare, when we tell people to do something, we don't acknowledge actually how difficult it is to implement in our lives. I'm someone that has my gym membership and I haven't been for a number of months, and but it is about having our whys and using that to drive us forward, even when those decisions are difficult in terms of diet. So definitely. Right, I must push on because I have loads of questions for you. So just one about intermittent fasting, and a couple of those actually. So someone's written, with intermittent fasting, can you not get hyperglycemic if you are already diabetic?
Hyper or hypo? What?
Hypo, sorry.
If you are diabetic?
Yeah.
And it depends. So some diabetics are not on any medication at all. Mm-hmm. Especially the pre-diabetics, we call the diet-controlled diabetics. They are not on medication. And if you are on medication, you have to be careful, especially if you're on insulin. I think I did mention if you're on insulin, you shouldn't be doing fasting. But if you're on tablet-controlled diabetes, yes, you can still do intermittent fasting. It all depends on which medication you are on. I would always advise, if you're on medication, that you seek support whilst doing it, and then you can monitor your own sugars. But some degree of fasting can benefit even those on medication, absolutely.
Great. And you've just answered a related question saying, can you fast if you're already diabetic and on metformin? So you
on metformin, yes, you can.
Yes, you can. Perfect. People have asked about the chart, which I again thought was great, the food items on the GI chart.
The GI chart.
And they've asked about the amounts associated with the food items. Do you have any indication of that, or is there a resource they can go to?
I think it's just within normal portions. I don't know whether there's an actual amount. So when they talk about white bread, we're talking about a normal proportion of white bread, maybe 2 slices. But you can see the glycemic index of white bread it's higher than sugar. So basically you are just eating sugar when you're eating your white bread. And unfortunately, white rice isn't far off. So it's just your normal portion sizes. I've got to be honest, we as Blacks, we tend to eat a lot more than our Caucasian counterparts when I'm talking about portion sizes. But yes, so an apple will just be one apple, a pear will just be one pear, grapes will be a handful of grapes. It will be just your normal portion sizes.
Great, thank you. Next one really is thinking about more specifically about diabetes and the different types. And I know you said you didn't want to over complicate it, but there is a question about type 1 and type 2 diabetes. And I wonder if you could just give us a quick overview of the difference so people have that in their minds.
Yes. So this talk was all geared towards type 2 diabetes. That's the one that is preventable. That's the one that is reversible. The major difference is with your type 2 diabetes, it's more about your cells' resistance to insulin. So you have insulin, but your cells are resistant to it. Type 1 diabetes is more or less out of your control. You didn't cause it, your lifestyle didn't cause it. For whatever reason, your pancreas is not producing insulin. So either there's damage to your pancreas for whatever reason. Some people, it's your own body's response to your own cells. Sometimes it's due to trauma. Whatever the cause is, in type 1 diabetes, you are not producing insulin, and therefore you need to inject. At the moment, it's all injections. You need to inject yourself with insulin on a regular basis, okay? But with type 2, you have too much insulin. The problem isn't that you don't have, it's just that you have too much and your body is overwhelmed, it's not responding to it. And that's the difference.
Great, thank you. And just a bit more about the likelihood and risk of type 2. So just to have a couple more. So one person has said that, what is the likelihood of type 2 diabetes in people that are underweight or thin and exercise? You know, can it happen? And what do you see in your experience of that?
Your risk is much, much lower. You are underweight, you're exercising, you're having a great lifestyle, your risk is much lower. I don't have figures, but that is where I fall into, okay? I have a high risk. A mother and uncle who were both diabetic and hypertensive, and therefore and I'm Black, and therefore I have a higher risk. So the only thing I can do is to look at my lifestyle, make sure I'm exercising, keeping my BMI, my body mass index, as low as I can, eating the right foods. And so my risk has got to be a lot lower than another person who has the same family history, but is 2 or 3 times my size, okay? Obesity is heavily linked with type 2 diabetes, heavily linked. So if you can address the things that you can't change your heritage, you can't change your family history, and you can't change your race. Yeah, this is our color until we die, but we can change our size. So address what you can address. So keep exercising, which is really good. Keep your body mass index as low as you can, and you're already cutting down your risk immeasurably.
Great. And some of the things have come through about more specifically about foods as well. So I'll group some of these together. So I think you mentioned it in terms of breakfast, and should I say actually time restricted feeding, and one of them was dropping a certain meal. Yes. And someone has written that there's much to say about breakfast being the most significant and biggest meal of the day, but is that necessarily a good thing for everyone?
It's a myth. Okay, I was raised with that. You got to eat your breakfast before you leave your house. It's a myth. You do not need to eat your breakfast. Or if you want to eat your breakfast, you can miss your evening meal. There is no hard and fast rule. When it comes to the metabolic benefits, the best meal, interestingly, to miss is your evening meal. That would be your best one if talking metabolically. But your evening meal is usually your most social meal. That's the one that you have with your family. You come back from work, you're together in society. It's far easier, more convenient to skip your breakfast, which is why I mentioned breakfast. But breakfast does not have to be the most important meal by any way, shape, or form. If you think that it takes quite a few hours for your insulin levels to drop after a meal, some research shows it takes 6 hours for your insulin to drop, and you have a very late night snack just before you go to bed. As soon as you wake up, you're eating a very sugary breakfast, cornflakes or the like. Your insulin is back up. You have not given yourself time to really recover and recuperate. And so you've got to give yourself hours. So if you can skip the evening meal, fine. I just find it's easier for my lifestyle and for most people to just get up in the morning, black coffee, water, out of the room, out of the house, and then you start your feeding window at lunchtime.
Great, thank you. And I think that, the other, not to say myth, but other thing that always gets driven on for breakfast is about porridge and oats. And someone's commented that looking at your chart, porridge may have a high glycemic index. So again, I don't know if you want to comment any more about porridge or oats for breakfast, but I think you've also got into the rationale for skipping breakfast.
Yeah. And unfortunately, oats, and I know, don't kill me here, I'm only the messenger, may not be the best choice for breakfast. Protein, get yourself an omelette if you can have vegetables and fish. They're far better, and definitely not white bread.
Great, thank you. And someone's just a bit more about the food, because it's very important to us all. Plantains, are they okay fried with low fat oil?
Plantains also have a high glycemic index, I'm afraid. Having said that, I had some last night. I'll be honest, I do love my plantains. But if you're looking at, so let's be honest, we need to live. Life is for the living. So as much as possible, you eat well. If on the odd occasion you have some plantain, that's not by any means a problem. It will depend on where you are right now. If you are diabetic now, you need to avoid plantain from this moment until you get yourself into a state where you are not diabetic anymore. You need to be quite aggressive. But if you are not diabetic and once or twice a month you have some plantain, that is a reasonable choice. I think we need to be reasonable because, like I said, life is for the living. And the way you have to be more aggressive if you've been given one of those diagnoses, like I mentioned earlier, in the metabolic syndrome. You can be slightly less aggressive if you haven't got the diagnosis. But if you want to reverse a condition, you really need to be quite aggressive. And plantain, unfortunately, is a carbohydrate with a high glycemic index. The greener the plantain, green bananas, green plantain, the greener the plantain, like unripe plantain, actually, they have a lower glycemic index, interestingly. But the more ripe a banana, those of you who are diabetic and you check your sugar levels, you do a check it before, have half a ripe banana, and then check it 30 minutes to an hour afterwards and see the spike. It's converted straight into sugar. So it's something that you should avoid, definitely. But the unripe ones are better.
Great. And as always, you're preempting people's minds, because as you were speaking, the question of is unripe plantain okay? And you answered it there. So that's great. And there's more about, again, about the risk. And so one person has emphasized again about is there a genetic disposition to type 1 or type 2? And then also the level of diabetes amongst Black and Asian people is high. And do you have any perspective of this in what happens in Africa and the Caribbean? And is there anything that we can learn from abroad in terms of how they're managing things?
That's a really good question. Whoever fashioned that question out was really, really good. We are at risk. I do not actually know the reason why. But you do find back in Africa, the risk tends to be higher in people who have other risk factors. So people who have truncal obesity, people who are overweight, and people who indulge. If you go into the villages and you see the hardworking farm hands, the hardworking, they generally don't have diabetes. So I think it's down to lifestyle. Now, type 1 diabetes, it's not what we're talking about here, but type 1, there is a very strong genetic link, and it's completely out of our control. You can't cause it and you can't stop it. It's nothing you've done, it's just there with your type 1s. With type 2s, however, yes, you have a higher risk if it's in your family, but that risk started somewhere. And I do believe that the risk is there because of lifestyle. So if you had, like for myself, example, a mother who had type 2 diabetes, she was overweight, a typical type A woman. Probably I'm very much like her, unfortunately, in that aspect. Very driven. She was overweight and her diet could have been far better. And so if I followed with her lifestyle, I would most likely be a type 2 diabetic by now. She was diagnosed when at a younger age than I am right now. So I think when it comes to risk factors, we say Black and Asian, I think it's lifestyle, that's the reason why. And I wonder also, I mean, this is just me wondering whether it is what we eat. So our food is very, very carbohydrate heavy, isn't it? We have rice and stew, but the stew is so little, but the rice fills the entire plate. We have our plantain, our yams. These are very high carb GI foods. And so I'm wondering whether it's a lifestyle thing, but clearly, regardless of what your race is, when you go on a low carbohydrate diet, the results are the same. Your HbA1c levels, your sugar levels start reducing.
Great, no, thank you so much. And I that feeds into it, but I just want to acknowledge people's questions. Someone is saying, my mum was diabetic, she had 5 daughters and 4 have had diabetes at different stages, and could the 5th also? And I think you've answered that in terms of the genetic predisposition, and it is a possibility. Not guaranteed like anything, but it's a possibility.
She just needs to change her lifestyle. She might not get it.
Perfect. And again, another interesting question, in our context now of COVID, and thoughts of any link between long COVID and late onset diabetes, because some people have developed diabetes after getting COVID, and just wondered if you had any reflections on that, please.
I don't know that much about it, but I have read the literature, and it's compelling, isn't it? I have, and I actually seen it in my practice here in Manchester, a few people who have had COVID and developed diabetes afterwards. So it's interesting. I know of a young girl who had COVID. How old is she? 20, 21. So an Afro-Caribbean. She had COVID, and a few months later, she was diagnosed with diabetes. They thought because of her age, it could be type 1, but it turned out to be type 2. She massively changed her lifestyle. and she's still on metformin because her sugar levels were so high, she needed insulin. But now she's just on metformin, so she's turned it around. I don't know whether there was a link. It's just a patient I do know personally, who I've seen. But I honestly can't say that much about it. I think we probably still need to keep on reading the research. COVID is a very, very nasty illness, that is for sure. It's awful, and that's somebody who's worked and lived in countries where we have had epidemics. What I have seen with COVID is unbelievable.
Yeah. No. Yes, I think just in what you've just said there, that COVID isn't just having an infection at that point. It has so many far-reaching implications, and as we all know, we all experience it differently as well. So yes, definitely. And people are asking more specific things about their lifestyles, and I again, really good question. So is it safe to use whey protein shakes to replace 2 meals a day in order to lose weight?
Whey protein shakes. This is way out of I'm just a GP. I must say, I have recently got some whey protein.
Yeah.
Not for myself, but I have a teenage son. And those of you who have teenagers, I don't know what it is about the boys these days. They just want to bulk up, and bless him, he's like a little spaghetti, but he wants to bulk up. And I had to do some research and go into make sure there's no additives. And I just 2 days ago got him some whey protein, which is made of, it's just from milk. So there's nothing else, not flavored. Personally, I do believe that any lifestyle or any diet that needs supplementation is not right. I do think that we should use our food as fuel and our food as medicine. So any diet, any lifestyle that you need to be taking, vitamins, this, that, supplementing, something has got to be wrong there. I don't think that's how we're meant to be living. And this is my personal opinion. Right. So for those people who want to increase their muscle mass, they may have some whey protein. I can't see why that would be an issue, but just make sure there isn't anything else in there, because they do sneak in lots of stuff in these protein powders.
I think you've hit on something really important there about also checking what we buy and the contents, because you're so right. Lots of things do sneak in, and you always are surprised. What you said about the white bread and sugar. I lived in America for a year, and I was shocked about how much sugar is added into the bread, but also here as well, everywhere. But I hadn't ever thought about it before. So it is like eating sugar. And someone asked something that I think many people can relate to, just saying about what else can she do? Or I'm assuming she could be a man, sorry. I'm overweight. I walk every day between 30 and 60 minutes. Exercise 4 times a week, and last meal before 7 p.m. and the following day eats about 9 a.m. So I think it's also, I'm sure you encounter in your work people that feel that they're doing the right things, but it's still not working. And I don't know, I know it's difficult to give individual advice, but any general advice that you could give to this person?
Absolutely. First of all, I must say, well done. Okay. There are so many tips that I mentioned today in this talk. So one thing that you could easily do is extend your fasting window. Okay. You could extend it a little bit, 1 or 2 hours. And then the other thing you need to look at is what you are actually eating whilst you are eating. Look at what you're eating. If you've got to a certain level, the weight is still not coming off, consider the GI index of the food that you are eating. That will be something that you could do. And did you say you're exercising 4 times a day?
A week, sorry.
Oh, so 4 times a week. If it's just gentle walking, I think that's absolutely fine. But if you are over exercising, especially for us women, that might be a stress on your body. So what we need is to make sure we're not releasing excess cortisol in any way. So Exercise will release cortisol. And if you're exercising for prolonged periods, frequent periods, that is not great. So sometimes you might be finding that even though you're exercising, especially cardio, you might be increasing your cortisol levels, and cortisol causes you to put on weight. So whatever's stressing you out, look at that. It might not be the exercise. It could just be that you're stressed at work, or there may be something happening back home that you're unhappy with that needs to be addressed. So my take-home message is stress makes it very difficult for you to lose weight. If you're not sleeping well, if you're stressed at work, whatever the circumstances, if you're over-exercising, you might not be, but if you're over-exercising, you're stressed, you're not going to lose weight. So you need to address those things first, and then the weight you will see will start coming off.
Great, thank you. And I think it really, someone else has written about their experience and highlighting the importance of, taking care when you put all these changes in, because like you say, sometimes you think I'm exercising 4 times a week and that's great, and people hearing it are like jealous, I wish I could do that. But actually it is about what is right for you, because someone says, I started with Slimming World and changed my diet by reducing carbs and exercise more. And after losing half a stone in a short time, she started to get hypoglycemic and paused for a while, and is on insulin, and apparently checks their blood sugar regularly. So they were just commenting that care is needed also when you're trying to make these changes, that in her experience as well.
I agree.
Yeah. And I think some of these are linked together. You're doing so well, thank you. The questions are coming thick and fast, but and we've got about 5 more minutes left, but so I'll race through some of these. But again, I think someone's written about portion control with our carbohydrates samples and stews. Will that help add more fiber in our food? And is that appropriate to do?
Yes, it's appropriate to definitely try and increase your fiber, and get your fiber from your fruits and vegetables. That's the best source of your fiber. There's a lot of talk about whole grain and whole grains. If you can get your fiber from your fruit and vegetables, that's far, far better. You can get more than enough from that. And look at a variety of, we know we are creatures of habit, aren't we? We like doing the same things, and it's still with our diets. We like to eat the same thing, but try and be creative. Try and add a different vegetable. It might actually help your gut health as well.
Perfect. And someone's written about unrefined carbs like dasheen, yams, cassava. Are they safe to have in small portions?
I think we mentioned earlier about being, it all depends on where you are in your health journey. So something small for somebody who is not diabetic will not be an issue. If you are diabetic, then yes, it could be an issue, because even if it's small, it will cause a massive spike in your glucose and it won't come down for ages. So it depends on where you are in your health journey. If you are not diabetic, small quantities, not a problem at all. That should be absolutely fine. But if you are diabetic, I think you need to exercise some control.
Great. And so someone's talked about berberine extracts, and had you heard of those for lowering your blood sugar? I'm not sure if it's the right pronunciation or spelling, but I think it is that concept, because there's lots of things around when you go on the internet and it's like, take this and it'll reduce it.
I have heard of it, but I can't say much about it. I've not read up about it, but I have heard berberine, berberine.
Yeah,
I have heard of it. But it's not something, like I said, I usually recommend food. Food, lifestyle changes. I don't apart from your vitamin D, which I think we should all be taking, because if we're this shade, I don't really recommend much else in the way of supplements. But I can't really speak into that, but I have heard of it.
Great. No, thank you. And someone's just talked about drinking more water. Can it help? Some people, I think, can it help with our with the fasting, etc.? I presume that's quite an easy answer, but
Yeah.
I'll let you say.
Yeah, absolutely. When we're talking about fasting, we don't fast the way that they fast during Ramadan, because they don't drink at all until the sun goes down. But intermittent fasting is absolutely fine to drink water, drink tea, drink herbal teas. Just be sure that there's no additives in your herbal teas. You'd be surprised that something they call peppermint has got flavoring in. But if it's pure peppermint, that's absolutely fine. Pure hibiscus, not a problem. So you're drinking fluids that will not cause your body to release insulin.
Because I think that relates really well to someone's saying they find chewing gum reduces their appetite or prevents them from eating. Is it a good idea? Because again, as soon as you said peppermint, I was thinking, oh gosh, but there are extracts in chewing gum. So what's your thoughts on that?
You see, when you are fasting, you should not be chewing. I read somewhere that the actual act of chewing can stimulate a response because your body thinks that you are eating. And as much, I can imagine if you're chewing, you might get, some people chew because the mouth gets a bit dry. Drink some water, that's far better, I think. Definitely.
And I think just as coming to the end here with this question is it recommended for, I think it's the age thing. So is it recommended for an 80-year-old who's with type 2 diabetes to do intermittent fasting? Or
80, did you say? 80.
Sorry, 80.
80.
Yeah, 80. And with type 2 diabetes to do intermittent fasting?
I would, first of all, say well done for an 80-year-old to be interested in improving their health. And I would support that person as much as possible. Everything has to be individualized. So if you're 80 and just on metformin, absolutely, why not? You can go on it. If you're 80 and on insulin, as mentioned earlier, no, you really need to be very well monitored if you're on insulin and you are fasting. So it will depend. Or if you're diet controlled and you're 80, yes, you can definitely do intermittent fasting. And you could be very gradual with it. If you take your tablets twice a day and you break your fast, so you start your feeding window at, let's say, 10 o'clock in the morning, you can take a medication there. And then you take your evening medication at 8 p.m. That gives you a nice window when you're not eating. And most of that time, you are asleep. So yes, if you are 80, I don't think the age matters so much. It depends on where you are health-wise. You could do intermittent fasting as a teenager or in your early 20s. And in fact, that's even better because your metabolic rate is really high. It will improve your metabolic status for many, many years to come if you can get your insulin sensitivity improved. But age is not a number. It's not an issue here, definitely.
No, thank you. And I've got, I'm going to push because someone's, they've repeated the question a number of times. I can see they're hinting to me to ask you. Is spelt flour good instead of normal flour? And I'm not sure. I don't know if I've heard of
wheat. I don't know what is spelt flour.
Yeah, I'm not sure of that. I don't know if the person could expand on that. But I suppose if we think of, are there any other flours that you would suggest instead of normal flour in terms of people's cooking?
Yeah, absolutely. So we know wheat flour it has a high GI index, wheat flour. So you'd be looking at, I don't know whether spelt is one, it's possible, but things like your almond flour, your coconut flour, your chickpea flour, these are much better choices as well. Absolutely.
Perfect.
I'm not sure what spelt is. I've heard of it. It's possible.
No, but I think what you've just said as well about the different types of flour is really helpful when people are in the supermarkets and trying to think, making a slight change can make a difference. Definitely. Dr. Ameh, I just have to say a huge thank you. That has been such a fantastic session. And as I said, I learned so much. And I thought the way that you articulated it was so clear and concise. And that has resonated with many people. So many people have said what a fantastic session it's been. So on behalf of everyone, thank you so much. And also, I just want to thank also everyone here. I said it in the beginning, but we never take it lightly that people are in their Saturday mornings, busy doing things for themselves and their families, and take the opportunity to really focus on their health and listen to our speakers. So thank you so much for your time. And thank you for all the organizations involved in CATHIP that have worked together to make these health hour possible. So thanking you so much. And I'm just going to hand over to Nicole to just give some announcements before we stop the recording. Over to you, Nicole. Thank you.
Hello, good afternoon. It's Hilda, actually.
Oh.
Hi.
Poor covering, Hilda, apologies.
Don't worry. I'm Hilda Burt, I'm the Health Partnership and Policy Manager here at CAHN, and I'm just going to do quickly some updates for you of things of interest that's taking place over the next few weeks. But before I start, again, just a big thank you to Dr. Vanessa and also Dr. Ameh for another very, very, very informative session. I've learned so much. I really do need to address my eating habits, but I will do that, and hopefully that will address some of the weight that I've put on over COVID. Again, a reminder, please make sure that you complete the evaluation information that's been posted. And also a big thank you to our partners, and that is BHI Lead, RAFA International Development Agency, Croydon, Ameh Forum, Enfield, Caribbean Association, RCCG, Sheffield. Also as well, a big thank you to you all for attending today. So if we go back to slides, we are promoting a gambling awareness session. Sorry, start again. If you go back to our slides, please, we're having our Windrush event in June, and if you're interested, please come along to that event. But also, if you'd like to have a stall, please register with us here. You can book a stall by calling us at 07312 082 832, or you can email us at windrush@carn.org.uk. The information will be in the chat, and my colleagues will do that on my behalf. Next slide, please. We're also hosting a gambling awareness workshop, and that's going to be on Monday. Sorry about the short notice, but we've got a guest speaker who's Tony Kelly, who'll be doing that as well. So again, if you're interested, the information will be in the chat, or you can contact us at communityengagement@carn.org.uk. Next slide, please, is about diabetes. And again, that's for next week. So our next health hour next Saturday is again going to be around the theme of diabetes, but this time gestational, can't pronounce that, diabetes and type 2 diabetes in children. And that's going to be next Saturday. So again, we look forward to you all joining us for that event. Again, you can register at events@carn.org.uk, or if you've got any questions, please email us at health@carn.org.uk. So please come along to next week's session, still on the theme of diabetes. And the next slide, please, is again our weekly health hour. So healthy art session, which is on Tuesday between 6 and 7:30. So again, another session that we run on a weekly basis. And that again, this Tuesday is about a dietary guide to type 2 diabetes management and prevention in adults. So again, please attend these sessions. If you want to know more information about it, again, you can email us at events@carn.org.uk, and it's in the chat. And the final slide is relating to the wonderful services that we provide around counselling services or our domestic and sexual violence helpline. Please, if you need any help around either of those two issues, don't hesitate to contact us by emailing us at help@carn.org.uk, or you can call or text on 077 10 022 382. And all of that information is available in the chat for you. Also as well, you can get copies of the slides from our Facebook and YouTube, of today's session on Facebook page and YouTube channel. If you want the slides, email health@carb.org.uk. Again, thank you all for attending and listening to another informative session here at our CATHIP. So I'll hand back to Dr. Vanessa.
Thank you so much, Hilda, and urging everyone to attend any of those sessions that you've just heard about, because I think there's been some great sessions that have been put on over the next week. So we look forward to seeing you there, and also look forward to seeing you next week at Health Hour. Thank you all so much, and a huge thank you again to Dr. Ameh, and have a lovely weekend all. Thank you. Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carb.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.